Hi guys, I'm Jamel.
My name's Tahur.
Thank you so much for choosing us for your upcoming sedation appointment. It's really important you watch this video to the end. We'll go through some do's and don'ts and a bit about what the patient should expect.
Before the appointment, we advise that you bring someone that's able and responsible and over the age of 18 that you can bring with you. So it's really important that the escort stays in the building when we're carrying out the treatment.
Yeah, so no popping out for coffee or anything like that, or do any shopping. They'll have to wait here and then we would pass over all the instructions. I believe it's really important that that escort only looks after you, so they can't look after any children or anything like that. So that escort should have sole care of you for 24 hours.
Another thing that we advise is no alcohol before the appointment and after the appointment as well.
It's really important that you don't drink alcohol in any form the day before the appointment or after sedation. I know it's easy for us to say you'll be very apprehensive, you probably aren't going to sleep the best the night before, but we are still going to be sedating you and we just want to be able to control all the situations.
We also advise no nail varnish before the appointment.
Yeah, so that includes acrylics and also varnish. We have to monitor you throughout the sedation process, and sometimes our vital machines don't give us accurate enough reading when somebody does wear nail varnish.
In terms of eating and drinking, we usually advise you can eat and drink up to 2 hours before the appointment and then just keep it light within that 2 hour period, so just some water is okay usually.
You or a patient will come in. We would obviously take some readings, we'll ask you a few questions, we'll speak to your escort and see that they fully understand what their responsibilities are.
Yeah.
And then when they get into the surgery, what do we tend to do?
So when you come to the surgery, then we'll pop you on a machine and it'll just give us some readings just to make sure everything's okay before we start. And then we like to put the cannula in then.
Yep.
So a cannula is basically a needle that goes in the arm where we can use a drug to put you in, and that's where we put the sedative in then.
So after we put the cannula in, we usually administer the sedative, which is usually midazolam. In some cases, we give it 15 to 20 minutes to make sure you're really relaxed. We will not start treatment until we believe that the sedative is working on you.
Yeah, so you'll be talking to us the whole time. Though you may not remember most of the treatment, you may remember the start and the end, but that's about it.
We will still numb you up after the procedure's done. We would make sure that you're all fine to go, and we'll make sure your escort knows exactly what has happened and what to do afterwards. Some post-operative instructions, or what instructions do we tend to usually give patients?
So we usually say try not to go to work for the next 24 hours or have anything important to do in the next 24 hours. You need to be looked after.
No operating heavy machinery. That includes driving a car.
Yes.
Although you might feel like you're fine and you're back at it, for 24 hours your insurance will be void.
Yeah, so no cooking, no driving, no responsibilities like looking after your children. I'd also say pets as well, just make sure someone's looking after them for you as well.
Also, the most important thing is no signing any legal documents. They will not be valid. And we usually tend to tell patients to put their phone away for 24 hours.
Yeah, so social media, stay off it.
Yeah.
You may think you're fine, but definitely for that 24 hours, you're not okay.
That covers everything. Thank you so much for choosing us. We really look after our patients and we do several of these cases per week. So you're in safe hands and we will make sure you're comfortable throughout the whole procedure.